Children with autism have differences in the way their brain develops and processes information. So as they get a little bit older, sometimes the signs of this start to come out. Usually they're recognizable by 2 to 3 years of age. But autism is called an autism spectrum disorder. And there are some kids who are severely affected by it and they can't function. There are others that are highly functional and they have a more mild form. If you suspect that your child may have symptoms of autism, talk with your pediatrician. They might ask you to fill out a questionnaire and also perform an exam on your child and then decide if further investigation is necessary for it. A few of the symptoms include the child lacks the ability to interact with others, they don't make eye contact, they may play inappropriately with a toy, meaning they fixate on a certain piece of the toy, they don't use it the way it's intended to. They might kind of seem like they're in their own world. These are just a few of the symptoms. So again, if you're concerned, talk with your doctor and they'll help you to know if anything else needs to be addressed. To date, we don't exactly know what causes autism. One of the strongest correlations we've found is genetics. Now, it doesn't necessarily mean that it's passed from parent to child, but we do know that parents who have one child with autism are at greater chance for having other children with autism. So that is one strong link that's been made. We think that there might be environmental factors, like a child could be predisposed to it, and then if they're exposed to certain environmental factors, which we don't know at this point as well, then that might trigger it. In the past, there's been theories floating around suggesting that vaccines and viruses cause autism, but there's no scientific evidence to prove that. In fact, there have been studies done to show that kids with autism actually have lower vaccination rates. So that kind of debunked that myth. Of course, if you go to the doctor with concerns and you hear the diagnosis of autism, it can be very scary and you're wondering, well, what's the next step? What can I do to treat it? There is no cure for autism, but it can be managed. And the earlier it's discovered and the earlier intervention happens, the better the chance the child has at doing well and being able to manage it as they get older. Your doctor would put you in contact with occupational therapists, behavioral therapists, speech therapists, and they work with both the parent and the child and give you both tools to cope from day to day. If you have any other questions for me, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms and recommend us to your friends and family too.